Welcome to Arts for the Health of It, a podcast where you will discover creative ways to improve your health and well-being. Someone may have told you that art isn't for you, but they were wrong. Anyone can create arts for the health of it. No talent or experience necessary.
I'm just a little songbird, try to fly my way homeward with the melody, and I make the beat. Don't know where it'll take me, cause when I'm in the dark of night, I sing my way back to the light. Come along with me and your heart will see that a song changes everything. Oh, oh, oh.
Hello, everyone. Welcome to Arts for the Health of It, the podcast. I'm your host, Richard Wilmore.
And I'm your co-host, Constanza Rader. If you've ever wondered how the arts can look when it's fully integrated into a healthcare system, then you are going to love this episode. We got to talk with Shay Thornton Kula at the Center for Performing Arts Medicine at Houston Methodist. And they have one of the largest arts and health programs in the nation. And was just fascinating and so exciting to hear about all the things that they're doing right now
and
have done.
Yes, and if you've never thought about it, watch it and listen too, because it is fascinating. I love her excitement and enthusiasm. I mean, we just kind of sat there the entire time and let her go because they're doing so much there, and the excitement is like bubbling through her, and so it was just fascinating to listen to her.
They're doing some really exciting new research and studies, which we'll have her back on again to talk about some of the results of some of the cool stuff that they're doing. And she also shared some exclusive resources that you can access virtually. And she shares about how to do that toward the end of the episode today.
Shay Thornton Kula is a passionate arts administrator with a specialty for bridging the gap between the arts and community and the health and business fields. She is currently the manager of operations for the Center for Performing Arts Medicine and is responsible for the strategy, implementation, and financial management of one of the most comprehensive arts and healthcare organizations in the country, as well as spearheading the Arts Integration Department. I mean, this is why she knows everything, because she's doing everything. And we're so thankful that she sat down this afternoon to talk to us. So without further ado, here's our interview with Shay.
Enjoy.
Absolutely.
Just for the upgrade in graphics, yes. Shay, you have, I think, probably the longest title to try to fit on a graphic in the entire world. You have 3 names.
I do have 3 names.
And then you're the operations manager for the Center of Performing Arts Medicine at Houston Methodist. I mean, who came up with all of that?
I mean, I'm not quite sure, but I know that each one of those are super important. So I'm going to double check your work and make sure that all of it is on there.
You should. I will record it again. If it's not, let us know and we can come back and re-record.
Perfect. Well, that's right. My name is Shay Thornton Kula, and I'm the ops manager for the Center for Performing Arts Medicine. And we are a fully integrated arts and health department inside of a hospital. So we're a little bit different than some other arts organizations that exist outside of the hospital and do the programming inside. We are Houston Methodist employees. We're badged employees of the hospital system that every day we report into the hospital itself, which is great. It offers us some opportunities to really be integrated into the healthcare environment. But it is funny coming from an arts background to be like, oh, I never thought I would be working in the med center. I never thought I would be walking in every day to a hospital setting. It's interesting how as artists, oftentimes we have a little bit of bravery to step into these situations and try to see what can I add to this and how can I be a part of this? And a big part of it is just listening and learning and seeing where you are and what needs to be done, and figuring out ways to use the arts to do that. What I get to do is look at all of our programs, right? So we have programs for patients, we have programs for employees, we have programs for the community members, and see what needs to happen to make all of those work, and kind of prioritize and say, where are we going to put our time resources, our money resources, our opportunities? Where's that all going to lay out? Because there's no shortage of really great ideas or opportunities, but we do need to figure out how can we work in the most effective way. Also, being an artist or an arts organization in a healthcare setting, we have to make sure that all of the work that we do is incredibly well thought out and purposeful and appropriate for that setting. So we never want to just start a program and be like, well, let's see how it goes. We need to make sure that we're speaking to all those different stakeholders and understanding really what's happening in that space. For example, one project I was just working on this morning, it's a Serenity Room on so it's a Serenity Room on a COVID floor. So for nurses to be able to take some space out of their day, not in a break room, and just be able to relax. So when we first went into this conversation with the nurse manager on that floor, really what I first heard was, oh, it's COVID floor, and oh, this is nurses, and we want to create like this restful, relaxing place. And I immediately had 14 ideas about what that could be. But then after talking with Sheila and really hearing what she wanted for this space and what those nurses or what that clinical staff was voicing their needs and how they were utilizing it already, we came up with something completely different. And there's a spiritual element on it. There's a plant wall, a live plant wall where nurses or clinical staff can adopt a plant. And that means it's theirs to take care of, just like they're caring for their patients. It's another opportunity for them to kind of tend and really look at it and have it be this peaceful moment. There's massage chairs and this really good foot massager. I won't give you the code to the unit door, but I will say that it's a really good foot massager.
Then this interview is over. If I'm not getting
It's all about the
code, you're out of here. Kick her out.
Okay, well, maybe I just won't say it online. That's what.
All right.
And then there's a wall that is all of our employee artwork. So some pieces of employee artwork that are kind of reflective in nature and to make you feel like you're in this much bigger space than you actually are. And they're printed on vinyl. And then next to the vinyl are these large prompts for relaxation or prompts for a meditation. So people can either use it just to look at the images or use these reflective prompts to kind of take a few minutes out of their day. But what I think was the really important lesson on that project, just like all the other ones we've worked on, is that we can go into a room and maybe be artistically minded and say, oh, this is what we should do. It should be creative writing all the time, or it should be whatever we're thinking of that day, whatever gives us some energy. But then really having that conversation and those needs guided by that unit gives us an opportunity to create something that's going to be meaningful for them and reflective of their specific culture and unit identity there, so it's been a fun project to work on. I will say, huge shout out to them. They were our first unit to turn COVID a year plus ago, right?
Wow.
And they're just incredible. They're so strong. They're so positive. And getting to work on this project and feeling like you get to be a teeny tiny part of their team has been very inspiring to me. And it feels nice to be able to support those that are the frontline caregivers.
Oh, and it's so important right now with burnout on the rise and mental health challenges that our healthcare workers are facing right now. It's such important work, and that's so cool that you get to be a part of it in your healthcare system. Which I'd love to back up just a little bit and see if you could talk about kind of the origins of the Center for Performing Arts Medicine, because I know it started as something a little bit different than it is doing now. So could you talk a little bit about that?
Totally. You absolutely teed me up for a really good commercial because this year we are celebrating our 25th anniversary of the Center for Performing Arts Medicine. And you're right. When we were originally formed by Dr. Stasny, it looked completely different than it does now. Dr. Stasny is this incredible ENT physician, and he was known as the opera doc. So he had opera singers come from across the country, across the globe, and say, "Hey, doc, I'm having this throat problem," or "Hey, I need to get back on stage tonight. What can you do?" And he was so dedicated to those artists and tried to find ways to care for them, just like we care for sports medicine or our athletes, looking at artists' health and seeing their unique healthcare needs and putting them back on stage as quick as we could. And that led to us being the official healthcare providers for the Houston Symphony, the Houston Grand Opera, and the Houston Ballet, meaning, like, for example, at the Houston Ballet, if you walk into their Center for Dance, they have a full Houston Methodist clinic. And every day there's athletic trainers from Methodist, there's massage therapists from Methodist, our orthopedists are there all the time, so that we're not only providing them a healthy environment to work in, but also extending their careers. And as artists, we know, especially in performing arts, our bodies are the tool. And if we're not properly taking care of that tool, we're not able to perform most effectively. So it started Artist Healthcare. And then as all of these opera singers were coming to Stasny, they started to have other needs, right? Oh, my hip hurts. Oh, I have this thing with my knee. Started to realize that, he could take care of everything from your shoulder up, but below that, he needed some help. So he started kind of getting this group of physicians together. He would pull an orthopedist from there. He'd pull an internist from there. He'd pull all the different kinds of physicians that you would need to care for an artist, and created this center. So all of these docs, right now we have a large roster of doctors that all are committed to getting artists back on stage as soon as possible and understanding their unique healthcare needs. So we have this artist card. You can sign up for it. It's completely free. And it's basically, so if you come to one of our hospitals, you're coded as this artist, and they'll know to alert. First, they'll alert CPAM, and second, they'll make sure that any of the docs caring for you that day will know that you're an artist. For example, maybe you're an opera singer and you wouldn't want to be intubated, right? That could hurt your cord. So they'll try to come up with other ways to care for you as specifically as you need to be an artist. And so when Stasny and team were caring for all of these artists, they came back and said, "Thank you so much. We want to give back to you now." And that's how CPAM started to get some legs. Our mission is to effectively translate the power of the arts into the healthcare environment. And we see that happening in 4 or 5 different ways. The first one is artist healthcare. So treating artists and caring for artists in that unique way. The second one came from the artists themselves. They said, "Thank you so much. You got me back on stage. What can I do for you?" And kind of casually, Dr. Stasny was like, "Oh, just go down to the lobby and, perform." And of course, they were willing to. Yeah, exactly. Sing as the ballet brings your car. And I joke. I mean, it wasn't just like that. But, I love the idea that we all know artists and we all know that feeling of wanting to give and wanting to perform. And what can I do in return? And so we started a performing arts series here at Houston Methodist. It's a fully endowed series, meaning that it'll exist for perpetuity. It's called the Margaret Alkeck Williams Crane Garden Performance Series. You thought I had
really
a long
enjoy
title.
your long names there, don't you?
I know, right? I think part of it is like mental, cues to remember all of these words together. Like, we're gonna have to start coming up with some analogies or whatnot. But we are the only fully endowed performance series in the country at a hospital, which is awesome. Wow. And in non-COVID times, don't you wish we could stop saying non-COVID
I know.
times?
I'm so tired of it.
Me too. We were one of the most active performing venues in the city of Houston, with over 100 performances a year. Our lobbies, were always full and active with music and dance and theater and creative writing and spoken word and all sorts of different kinds of programming that was reflective of the environment of care at Methodist. And we think of that environment of care is trying to create a wraparound environment where the healthcare experience is humanized by the arts. So it's not just some elevator music playing beautifully in the lobby, but it's music that will kind of meet you where you are that day and help guide you on your journey towards wellness. Maybe that means you're a nurse and you're heading up to your shift, or you're just running down and getting coffee real quick as a loved one. Maybe it means you're a patient and you're nervous to go into your procedure this morning. We have 7 staff pianists that play 365 days a year, on Christmas, on Easter, on all the holidays. And one of them actually starts at 5:40 in the morning. So he catches a lot of those people coming in for surgery. And he's one of our most beloved. He's been with Methodist for 12 years now. He thinks it's the greatest gig. We think it's the greatest gig for him. So really looking at what are the needs of the hospital? When are people coming? And why is it important to have music? And what does that music look like? Making sure that that music is not necessarily what would be incredible at Jones Hall downtown, right? Not something that would make a really activating or, oh, what's going to come next concert, but something that's supportive of that healing environment. One of our other pianists, Daner, who actually used to be a piano player at Caesar's Palace in Las Vegas. So
fancy.
That's a fun fact for the day. I brought my computer out of my office one day and I was just working in one of the lobbies and just needed a different space to kind of work. And I saw he was playing beautifully. And a woman walked into the lobby space that was really having a challenging moment. She was visually upset, and she looked like she was just really struggling. And without turning his head, without turning his body, he was able to kind of take that in and changed mid-song into this spiritual song that created a much more healing environment for her to take a moment in the middle of the day and really be able to process that. And so when we're looking at artists and when we're programming our spaces, we try to make sure that whoever is going to be with us that day understands that the music is going to be helpful on their on our patient's journey, or the music can guide people on their way, and that we want to create an environment where people are able to take that journey and that we can go with them on it. And it's not just, the greatest hits of Bach 24/7, but it's music that can meet people where they are. And we're in Texas, so sometimes that means country. We're also in the Med Center, so sometimes that means international music because people come from everywhere. So that's our arts integration. We also have an incredible visual arts program that falls in arts integration. And really our visual arts program came from an employee photo contest that we started about 15 years ago, where we asked employees to submit images to get put on the walls. Beautiful. Great idea. Love it, right? It's
Easy.
grown. Easy. Let's all do one.
Yeah.
So it's grown, and now we receive over 1,000 submissions a year.
Whoa.
And we have to fully adjudicate it. We have a pre-jury, and then we have a jury, and then there's this large gallery space that gets filled up from it. But for us, it means employees, just like this image actually behind me, which podcast listeners you cannot see, but I will tell you, it's gorgeous. And they're images from our employees that give them an opportunity to give back to the soul of the hospital. So next to the photograph is their name and the unit that they work in at the hospital, and maybe a little bit of information about them. So if I'm a loved one, or if I'm a patient walking around the hospital, I can see that my nurse might not just be my nurse. She might be this incredible photographer. My phlebotomist might not just be a phlebotomist, but they might have this awesome, arts background, and really kind of humanizing the experience by humanizing those that work in healthcare. So our arts integration team is really worked super hard this past year to think about what the patient experience is and how we can use the arts in the most effective way to create a healing environment, especially in COVID, when you can't do a lobby concert and people aren't walking around the halls to go look at the artwork. So really rethinking what happens in the patient room and how can I affect change in that. that's our second department. I have a couple more. Is anybody going to start
Keep
pulling
going.
the plug on my time?
We're here. This is awesome.
And then our
So
third
sure.
department are the creative arts therapies. And this one I'm so proud of as well. When I started at Methodist 6 years ago, we had one phenomenal music therapist. They were absolutely incredible, taught me so much about how creative arts therapies could be effectively used in a hospital system. But now we have 12 music therapists. So in 6
Whoa.
years, we've grown
Wow.
from 1 to 12. And the reason that growth has happened, it's all been so organic, because we'll put a music therapist or an art therapist on a unit, and we'll have them embedded there. And that means that they're dedicated just to that one unit. They don't have to try to go around the whole 800-bed hospital, just that one unit. And they get to know the unit and the patient population, and they're able to create these interventions that effectively meet the patient where they are, enhance their clinical goals, and especially this last year, are really serving the staff and are able to provide, maybe it's environmental music therapy, maybe it's a staff support group, maybe it's some creative arts intervention that they're able to use and do on a unit when they experienced a traumatic death, or when the unit is just particularly stressed, and they're able to use that training and effectively work in that space. So our creative arts therapies department, they're phenomenal. They're absolutely great. And then the last area that we have is our research area. So what makes CPAM a little bit unique is that all of this is embedded in a hospital environment, right? And when you're in a hospital environment, especially an academic institute like Houston Methodist, you have all these resources for research and minds that like to think outside the box and are willing to say, hey, I know all of this about brain imaging, and you know all about this, all about music. Where can we combine on this?
Oh, it's so exciting.
I know, it's so cool. And our director of research, Dr. Christoph Karmanik, has been with CPAM for a long time now, and he really is an imaging specialist. So his specialty is to look at, for us in particular, is to look at the brain and what's happening in the brain while you're listening to music or while you're viewing art, and trying to take some basic science and then translate that to actual health. So one example that I'll talk about is our stroke study. So we started this project probably 5 or 6 years ago, and we were just looking at what is activated in your brain while you're listening to different kinds of music. So we put healthy subjects into an fMRI. An fMRI is a functional MRI. So it's like an MRI with crystal clear pictures is how I'm going to explain it. We put healthy subjects into an fMRI and played them all kinds of different music. So we played Bach. We played their patient preferred or their self-selected music. We played Gagaku. We played somebody reading a textbook. We played, just anything you could think of that was just different. We put all these healthy subjects in a fMRI. We were trying to see what we'd come up with. We wanted to see, well, is everybody's brain going to respond the same to somebody reading a textbook? Is everybody's brain going to respond the same to what happens when you're listening to Bach? Or what's going to look like this? What's going to happen out of this situation? So after that first round of study, we had Dr. Karmanik look at the scans, and he basically said that if you gave him a sample scan, he would be able to put it in a box of what you were listening to. So
wow.
I know, isn't that incredible? So what the scan shows is blood flow activation. So imagine a slice of your brain, right? You want your brain to be fully activated, and you want the blood to be going to all these different parts of your you want the blood to be flowing to all these different parts of your brain. So he was saying that by just looking at this one scan, he could say, oh, you were listening to Bach, or oh, you were listening to Gagaku, or you watched somebody or listened to somebody read a textbook. And that was fascinating, right? We're looking at the different areas of the brain that are activated by different kinds of music. And when I'm saying kinds of music, I should probably speak more specifically. But we were really looking at patient preferred or subject preferred music. So maybe your wedding song, maybe the song you sang to your kids as they were growing up, maybe just like this jam that you, every time it comes on the radio, you're like, absolutely, 1980s, come at me.
Yeah.
Versus different kinds of, maybe it was a classical piece, maybe it was a classical piece of music that you actually were watching the notes on the screen in front of you of the fMRI while you were doing it, and how that was playing a role in where your blood flow was going. So we took that information and said, okay, this is great to know and fascinating, and I love it, right? But how can this affect patients, and how can this affect health? And we started our next version of that study, which is it's with stroke patients, and it's still actively going on. So I'm not going to give you the final results yet, but stay tuned.
We can't have breaking news here. This is what this podcast is about, and you're ruining
You
our
could
streak.
have breaking news, but do you have the I'm not
You
going to
know,
do it
yeah,
on the
that'll be
sound
edited in.
Okay, never mind. I'm still not going to do it. But now the part of this study that we're working on are with stroke patients. So what is music? Music can be a really easy intervention, right? You wouldn't necessarily have to come. So you're a stroke patient, you're treated, and then you're discharged to go home. And if family members and loved ones really want you to get back as healthy as you can. And we know with stroke patients that if we're able to activate different areas of their brain, they're going to be able to progress quicker and have a stronger chance at the return to where they were neurologically before. So if we can do that through music, if we know, hey, this music is activating these different parts of my brain, that would be something that would be easy for families to be able to provide their loved one. And so we've created, there's three different groups in this study. One are our control, so they have no specified listening list. Our second group are books on tape. And our third one are directed music listening playlists. So it combines patient preferred or subject preferred music, and it alternates between that and music that we've shown through these previous studies activate specific areas of your brain. So that could be an hour-long playlist that goes from my favorite song growing up to this song that CPAM has, data showing where it's activating. The next song could be my wedding song, and after that, just repeating back and forth, kind of priming that brain and getting blood to flow to as many different areas as we can, which is, again, a really easy thing that we can do for patients that could make a lasting effect. So I'm going to shamelessly plug here. Follow the Center for Performing Arts Medicine, join our email list, all of those things. And we really hope to have this study, COVID slowed it down a little bit, but we hope to have this study completed and data out there sooner rather than later. The data that we've been looking at and seen so far is really promising. So fingers crossed, that would be such an awesome opportunity for us to care for those with neurologic conditions and use music as a way to help them on their journey. Obviously, it won't take away damage, but it can help them on their journey towards wellness. So that's
amazing. Shay.
35, 45, 60 minutes in. That was my CPAM spiel.
The end. I think you answered every question we had.
I know.
I think I took all 25 years of CPAM and I just talked for all of it.
That was so great, Shay. And we'll have to have you on again once those results are out, because I'm sure our listeners will be. I mean, I know I'm curious to see what those results are, because just for people who may not know about what a stroke is and how it damages the brain, can you speak to that a little bit and why blood flow is so important?
So we want to activate all the different areas of the brain. Basically, when you have a stroke, the one part of your brain, the blood flow isn't quite making it to that area. So if we're able to, just like you warm up your body before you work out, or just like you're taking care of all aspects of your body, we want music and we want blood to go to the different areas of your brain to allow those cognitive processes to happen. That's probably the easiest way to talk about it. Does that make sense?
Okay. Yeah.
Good.
I mean, yes, I think that was a good explanation. Did you have something else?
No, I was just going to say, and absolutely, we would love to come back when those results are out. And I'd love for Dr. Kermanik to come on because this is really his specialty, right? Like I'm here to be like a hype woman and say, wow, this is so great, and see how all of this combines. Because what is specifically unique about CPAM is the way that all these programs affect the different populations in a healthcare environment. So we have arts integration programs for the public and for patients. We also have bedside programs for patients. We have employee arts enrichment activities. Just tomorrow, we have a poetry class for employees to be able to join for National Poetry Month and maybe try their hand at that. And then this research element also allows us to look at what the future is going to be and how can arts and health be combined for the future of health and well-being, and not just in, when you're physically in a healthcare space, but how it can affect your overall life cycle with the health system.
Well, and that's kind of why we're here, and the Arts for the Health of It podcast is, we know how important the arts are. And are continuing to learn more on a daily basis about how important the arts are for our health and well-being. And we have that same question of how can we encourage people to incorporate arts engagement into a healthy lifestyle, just like we do with good nutrition and exercise and mindfulness, all those things, that the arts should be a piece of that as well. And so I'd love for you mentioned like the future. What do you see happening in the future for CPAM?
That's such a good question. I feel like I'm in a performance review right now, so I'm getting a little nervous.
Where do you see yourself in 5 years?
I'm going to look at where do I see myself in 5 years? Possibly still on this phone call if you let me keep talking.
Listen, if we're around in 5 years, good for us.
You will be. Well, I think so. So one of the questions we get most at CPAM is, that's awesome, and how can I start a CPAM, right? I'm in a hospital setting. Maybe I have an arts background, maybe I don't, but how can I start a CPAM? What does that look like? And I think for where I see CPAM in the next 5 years, we're taking these programs, right? We're a system center. So Houston Methodist has a campus in the Texas Medical Center, which is the world's largest medical center. I know I just keep dropping these nuggets today, right? Just dropping these fact sheets. So we have a hospital campus here in the medical center. We also have an academic institute that's attached to that right here in TMC. We have 6 community hospitals, and then we have 1 long-term acute care center, so an LTAC hospital. All of our programs are system-wide, so we offer them at all of the campuses. But what I would love to see is that it's not just coming from the Texas Medical Center and going out, but each of these campuses has their own kind of CPAM staff embedded in those hospital campuses, really specific to what the culture there is, what the need there is, what's happening. Is there going to be a magnet thing? Should we have a magnet team over there? We've done that with music therapy. So we have music therapists that are embedded at specific hospitals. But I would love to see that on arts integration and education and outreach, and maybe even research, and really looking at that as an opportunity for us to grow from within. And also empowering our healthcare professionals. I think, over this last year, we've seen, well, I like to think so. I hope somebody agrees. Oftentimes, healthcare professionals and artists are some of the first to raise their hand to say, how can I help? Yeah, pull me up on it. I want to try. So creating these programs at all of our campuses that allow healthcare professionals to see themselves beyond just what they do that day, so what they might do during their shift, but allow opportunities for them to reflect through the arts in a healthy way that to extend their career in healthcare. So if we're thinking about a shift nurse and she's had a really challenging shift that day, and it feels like, oh my goodness, the walls are kind of caving in, or this is all just weighing really heavily on me. What are easy to access programs that we can provide for that individual or that unit that allows them to be more effective the next day when they come back? And how can we use the arts to empower people to think like that and continue on their healthcare journey, right, as a staff member, which is different than that as a patient? Does that make sense to you guys?
Yeah, that does. And to kind of tag on to that question, I think part of, achieving a future where all patients could one day have access to these types of services, we really need healthcare policymakers and administrators on board. And I'm just thinking like, okay, I'm a hospital administrator. Okay, this sounds all like nice and fancy, but how do I pay for it? What's the benefit to the healthcare system? How do we bridge that gap? And that may be too big of a question to just like throw in at the end here, but maybe take a stab at it.
Well, I would say you totally sound like a healthcare administrator, right? How am I going to pay for it? What's it going to do? And who are those people?
Which maybe have talked to a few administrators.
Yeah, exactly. You might have experience in this realm. Well, I think that's a really good question. And my background before I came to CPAM was I worked in local arts organizations, so arts advocacy. And oftentimes that job was sitting in City Hall and talking to mayor or council members and saying, hey, this is what we're doing and this is why it matters. And that experience, which was unique in itself, kind of prepared me to go into a hospital environment where 24/7, anytime you're in an elevator with somebody and those doors close and they say, what do you do for that? What do you do at the hospital? You get that opportunity to pitch. This is what I do, and this is why it matters. And here's an incredible story. And here's something that makes me wake up every morning and say, yes, I am ready to go to work. And we have to look and be really specific to our audience, right? So one of the things I do in my job is look at our HCAP scores. So before you start yawning, promise it won't be as long as the first spiel. I saw your cat yawn at me.
She just spoke to me and was like, is this over yet?
What's going on? So HCAP scores are mailed, or the HCAP survey is mailed to a patient after they leave the hospital. And it's basically this nationwide standardized survey on your experience in the hospital. The reason why that matters is the survey scores are directly related to the financial reimbursement from the government healthcare system. So let's say you both get an appendectomy. You get your appendectomy at Hospital A, and you get your appendectomy at Hospital B. And Hospital B scores, let's say, 70, and Hospital A scores 100%. That means that Hospital A, even though you got the same procedure at the same time with the same kinds of clinicians in the room, Hospital A is going to get compensated or reimbursed in a greater fashion than Hospital B. Okay, so that's why HCAPs matter. So what we do here is we look through all the HCAP scores and we look for citations on, maybe it's photography, maybe it's pianists, maybe it's arts programs, whatever those kind of citations that we could pull out from. We look at those in the open comment section, and then we'll also narrow in on units. So for example, I was recently reviewing them on an outpatient infusion unit that we have a music therapist on, and really looked at what are the things that therapist focuses on, like things like wait time, things like anxiety, and trying to track trends there so that we can go to that nurse manager or that director of that area and say, look at this. Wow. In 6 months, we've been able to be a part of this transition. And here are our citations, and here's our this. Oftentimes, if we're doing something really unit specific, we'll also do a personalized survey that so if it was a music therapist, that some of their patients would use as well. If it's a public program, we take HCAP inspired questions. So things like noise levels, organization of a room, communication, things like that, and ask those in a performance setting. So there's not going to be there's never going to be a question on HCAPS that says, and how was your arts program? Because that is not universal, at least not yet.
Not yet.
Yeah, exactly. Fingers crossed, next 5 years.
5 years, exactly.
But we are able to start making those ties and saying, hey, this is these are the goals that we're after, and this is how we're reaching them. We can also talk about how cost effective it is, especially with some of the other more financially intense things that happen at a hospital, right? The arts programming can be a value added with not much of a cost attached to it. And then we'll do the same thing for employee opinion survey. So turnover in a hospital is really a challenging thing nationwide. Nursing turnover particularly, and making sure that we're attracting and then retaining the best employees we can. And since so much of our programming is employee based, we want to take a look at those employees and see how, what are they responding to our questions on compassion fatigue or burnout, resiliency. Are the programs that we're doing actually effective in that? And one story we have with the employee arts enrichment classes, this was again pre-COVID, but we took a group and our theme for the day was resiliency. We took a group from the hospital. We all got on the train. We went 2 stops down to the Museum of Fine Arts Houston, and we went and got a behind the scenes Van Gogh tour from our friends over there. It was awesome.
Cool.
I was like, it sold out. Well, it sold out free, right? But it sold out really quickly. And I was like, I'm really glad that I get a spot as a facilitator because this sounds amazing. And so we were looking at the Van Gogh works, and everybody that's coming that day has a different job in the hospital. There are people coming in scrubs. There are people coming on their days off. There are people coming straight from their administrative job. Like, right, that group is just diverse when you look at it, just diverse in itself. And we were looking at all the Van Gogh pieces and kind of having these conversations. And I was like waiting. I was like, okay, but when is the teaching artist going to talk about resiliency? Like, when's that going to happen? Because that's the point of this class.
You're getting nervous over there.
I was getting a little nervous. They were doing a great job, but I was like, should I say something? Should I just yell resiliency and run off? And so we got to this one image, irises, and it's a beautiful picture where there's this beautiful yellow backdrop and all these flowers kind of hanging out. And then there are these leaves that kind of like stick up straight up and down, like very angular. And we were looking at this, and a teaching artist says, and why would this be resilient? What's resilient to you about this image? And a booming voice from the back, I tell you, it was kind of like a magic movie moment. A booming voice from the back says, the leaves are. Everyone's paying attention to these beautiful flowers and the accoutrement, but the leaves are what's keeping everything up in place. And then we were able to have a conversation about what does that look like in your work environment, and how do you show you're resilient when everything is patient centered, and it should be. Everything's about the patient and how we're able to care best for them in their unique circumstances. How can you be the leaves in that situation? So just a really lovely example of we can take people, we can provide these experiences for employees. But the magic happens when employees are also buying into it and saying, this is important for me because, and this is how I can share what I know and, bond with my coworkers and whatnot to have these unique experiences.
That's such a great story.
Thank you.
I have 2 final questions.
Okay.
Well, I guess one has 2 questions in it. But anyway, what does HCAP mean? And is it that every person who steps foot into a hospital for an appointment gets one? Or like, how do they who gets them?
That's a really good question. So HCAPs are basically the patient's perspective of care study. So I'm going to say it slow. The HCAPs means Hospital Consumer Assessment of Healthcare Providers and Systems.
The Center for Performing Arts Medicine must have come up with that name because it's a long one. There's a theme here. I'm going to retitle this episode.
HCAPs.
Yes.
Exactly. Actually, just don't title the episode. Just put letters in it, right? And then see who comes.
All the letters.
It's going to be like a coding thing. It'll be great. It'll be great. So there are, I say HCAPs, but there are a couple iterations of that, whether you're inpatient, whether you're outpatient, behavioral health. But HCAPs is just kind of how we can start the conversation about what a patient survey is. And the important thing to remember with HCAPs are that it's nationwide. And so you are going to get the same survey that I get, regardless of where you are. And that's in an effort to make sure that we're standardizing care and that you know, regardless of where you're going, it's understood kind of what that experience was like, which I think is a really good thing. HCAHPS scores are also really helpful for units. So let's say maybe you learn from HCAHPS scores that is something simple, like it's too noisy. Those are simple like policy things that we can change at a hospital. Like let's put in these quiet hours, or let's work on, you know, maybe the food services trays don't need to go through the whole unit. Maybe we can just drop them off at the beginning and individually walk around things. So it provides all sorts of good information for the healthcare organization itself. And speaking of, when you're an artist or an arts organization and you're trying to be embedded into the fabric of a healthcare organization, using these markers that already exist, and everybody in administration is going to be talking about them anyways, using those markers and finding ways to pull arts enrichment data out of that, it's just a value add. It's a win-win, right? You're speaking the same language, and you guys are coming to the same, you're saying, I want to get to that same place with you, and here's how I can be a part of that conversation. And our team here at Methodist, I mean, they've been so incredibly supportive. Like, we kept everybody fully employed through the whole pandemic. We're growing each and every year. Just the amount of support that we have operationally, philanthropically from our community, it's absolutely incredible. And I want to give major kudos to Houston Methodist, because without that backing and without that saying, yes, you are right, the soul of the hospital is an important piece, then why be there, right? And that's been the way from the beginning. There's this mosaic that's now in our Bush Atrium, so one of our newer towers. And in the 1960s, it was installed on the front of the hospital. It's this beautiful mosaic. There's like 1.8 million pieces to it or something. So just a small piece, right? It's huge. It's huge. And they put it up at the front of the hospital in the 1960s. And then trees grew. And then they had to build a porte-cochere. And then the whole Texas Medical Center erupted. So it was kind of hidden and out of view. And it's this mosaic with Jesus in the center as Christ the healer, and it tells the story from left to right of medicine. So it starts with, ancient medicine. Then you see Florence Nightingale. And then you see modern medicine from the 1960s, which is like a microscope. And you see an operating theater, and kind of it's telling the tale of like, this is where we've been and here's where we are now. And when Walter Tower, when our newest tower was being constructed in 2018, 2019, they actually took down the whole mosaic. They had to bring in this restoration company from Italy. They chopped it into 81 pieces, like this big mosaic. It was absolutely fascinating. I stood on the crosswalk and I watched it. And then they took down each piece and they kind of cleaned it and they, repurposed it, made it beautiful. And then now in the atrium, they've put up the whole mosaic inside so you can see it left to right. And it tells the tale of not only modern medicine, but also Methodists believing from the beginning that art and artistic experiences can enhance the healing environment. And we don't just go, a hospital is not just a place outside of the community, but the best thing that we could do is create a hospital that's integrated and accessible for various members of our community, regardless of who they are or where they're coming from. And so using the arts as a conduit and using the arts as an opportunity to say, this is a space for all of us, right? Let's talk about us. What do you see in that mosaic is a great way to make it a place that's not just for the sick, but a community-based organization.
Oof.
Wow.
Powerful.
You talked about the Serenity Room, and you talked about poetry with the staff. Medical staff is notorious for not having enough time to do anything outside of caring for their patients, and they don't understand how important that is to take care of themselves. Do you have something to end today, like a quick something, arts engagement that medical staff could do today to take a moment for themselves?
That's a really good question. I feel like that was like a prompt for all of us. We're all like, excuse me, I'm going to pull out my watercolor set and then I will get back to you.
You can pause this, go get your supplies, and then come back.
But I think that, when we look at employee arts enrichment activities and we're trying to brainstorm about what people might like, we try to think of, okay, what haven't we ever done before? What haven't we done in X years? And trying to make sure that we're creating a space for each individual employee, and that you and I, we might not dig poetry writing, but next month when we're offering this Gregorian chant meditation workshop or whatever it is, it's going to appeal to a different group. So one of the challenges working in this space is trying to always come up with an art activity. So for example, in January, we did a bunch of watercolor activities. In February, we found a bunch of different ways to celebrate Black History Month and what Black artists have done to the arts community in the city of Houston and why it's so vibrant and fantastic. And we did a lot around Lunar New Year, trying to find different ways to connect to our diverse populations. I would say, and maybe we can put it in the show notes, that we have a great series of guided meditations, mostly done by our music therapist, but some done from the rest of our team as well, that allows you to take 5, 6, 7 minutes and using art and using guided meditation practices allows you to create this space of healing and create a little bit of a bubble inside your day before you move on to that next step. So can I send you those and maybe you can put them in the show notes?
Yeah, that would be great.
Great.
Yeah.
And how can people learn more about CPAM and connect with you if they want to learn more?
Absolutely. So the easiest way to reach us is probably on our newsletter, which is from the Center for Performing Arts Medicine at Houston Methodist. You can sign up for that online. Our website is www.houstonmethodist.com/CPAM. I'll say it again, like I'm leaving a voicemail. www.houstonmethodist.com/CPAM. And you can also follow us on YouTube. We have a YouTube channel, the Center for Performing Arts Medicine. And there's always some fun virtual employee choirs. We just had our virtual employee choir do God Bless America at the Astros game home opener, which was really fun. People just thought it was, like, our employees as well as people at the game just thought it was super cool. And so there's always opportunities there to connect virtually, and we'd love to hear from you and ideas on maybe what could be coming next.
That's awesome.
Well, make sure you come back when you figure out what's coming next.
No pressure though, right?
No pressure, but we'll see you next week. Shay, thank you so much for joining us today and talking with us about what's happening there at the at CPAM, the Center for Performing Arts Medicine at Houston Methodist. It's Shay Thornton Kula. Did I get all that right?
You got it all right. Thank you so much. I really appreciate our time together, and good luck on everybody's journey, and I hope everyone is well.
There you go. We'll put all of the notes in the all the notes and links on our website, heartsneedart.org. Click on the podcast link. Listen, watch. You can watch the YouTube so you can see the painting behind Shay when she talks about that. And we will see you next week. Make sure you subscribe wherever you're listening or watching. Have a great day, everyone. Keep creating. Bye.
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 Thank you for listening to Arts for the Health of It, a podcast produced by Hearts Need Art, creative support for patients and caregivers, in partnership with the National Organization for Arts and Health. You can help others learn about the healing power of the arts by subscribing, sharing, and reviewing the podcast wherever you listen or watch. The podcast is hosted by Richard Wilmore, co-hosted by Constanza Rader, and produced by Ivan Briones. Our theme song, Songbird, is written and performed by Natalie Lane. Visit heartsneedart.org to learn how you can support our mission to create joy with people facing life-altering health challenges. Join us next week to learn more ways you can create arts for the health of it. The views expressed on this podcast do not necessarily reflect the views of Hearts Need Art, their staff, board members, or other affiliates. All content is created for informational purposes only. This podcast is not intended to be a substitute for professional medical advice or to diagnose and treat any health condition. Always seek the advice of your physician or other qualified health professional with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you heard on this podcast.